Philadelphia-positive chronic myeloid leukemia, or Ph-positive CML, is a slowly progressing leukemia, a cancer of the blood. Once diagnosed, it is life-changing for the patient and those closest. Now, there are various therapies, and measuring the response to therapy is critically important to treatment. With me this morning is Dr. Eric Feldman, a professor of medicine at the Weill Cornell Medical College, to discuss Ph-positive CML, and Jamie Pierce, who has Ph-positive CML and is undergoing treatment right now. Good morning to the both of you. Thank you so much for being here.
Good morning. Good morning. Thank you.
Doctor, I do want to start with you this morning because I don't think a lot of people really understand leukemia, what it is. Could you explain a little bit about it and also how Ph-positive CML is unique?
Well, leukemia is a disease of the bone marrow. That's the organ that makes all our blood. And what happens in leukemia is that certain changes in the bone marrow, what we call mutations, happen. And these mutations allow a cell to grow out of control. And as it grows out of control, it doesn't allow the normal bone marrow cells to be made. And so this abnormal growing cell takes over and starts to spill out into the blood with high white blood cell counts. The spleen gets enlarged, but eventually the bone marrow, it fails, and patients develop life-threatening infections and anemia and bleeding.
You know, and I don't, forgive me for sounding a little bit simplistic about all of this, but I think that, Jamie, a lot of people out there want to know, what is it like living with Ph-positive CML?
It's very, very scary in the beginning. It's fearful to hear those words directed toward yourself. And you must really, really be comfortable with your treatment and be positive and just go on. Your families depend upon you, and your professional people really depend upon you. So you just have to keep going, and you have to have faith in your treatment plan.
Absolutely. Doctor, what is, I guess, the most common problem that people with Ph-positive CML face?
Well, the most common problem, I would say, is staying with the treatment. Right now, we think that it's most important that patients continue treatment at this point indefinitely. And all treatments have some side effects, and it's important that patients bring these side effects to the attention of their physicians, because there are many things that can be done, including switching from one treatment to another to reduce these side effects.
Well, you know, getting back to you, Jamie, it's interesting because I was just kind of observing and listening to you and makeup, and I couldn't help but tell you then, what did I say? I said, my gosh, you have such a great attitude, and you really do. You just seem to be so strong throughout all of this. How do you keep it up? How do you keep that terrific attitude, and where do you see yourself in the future?
I feel very well.
Okay.
I feel very, very confident. I take very good care of myself, probably better now than I had before, because I'm much more aware of things. I eat very well, I exercise, and I became very, very involved in my family and my son's life. I had 2 teenage stepsons and a little boy that I had to keep going for. I just really enjoy every day now, and I try to take the best care that I can.
Oh, that is just wonderful to hear. What advice then do you have for Ph-positive CML patients who, let's say, they are just diagnosed?
First and foremost, you must be very, very comfortable with your physician. You have to be able to speak to your doctor comfortably. You have to be able to ask questions. There are many questions, and sometimes they seem silly, but you have to be able to ask them. You have to educate yourself. You have to look on websites, and there are societies and organizations where you can get information, learn how to manage with your treatment, learn how to manage any side effects you're experiencing. And also, I think it's very, very important to seek people out who have experienced this, who have gone through with this disease and are either successful or not so successful, and find out what you can do, what relates to you, and just make your life as happy and good as you can.
Oh, well, great, great words of advice. And Dr. Feldman, Jamie, thank you so much for coming on the show and helping really to increase awareness about chronic myeloid leukemia. I appreciate it so much. Thank you.
Thank you.
And after the break, we continue our discussion of Ph-positive CML by talking to the caregiver of someone diagnosed with this form of cancer. We'll be right back. Well, welcome back to The Balancing Act. And this morning we're discussing chronic myeloid leukemia, a form of blood cancer that is not curable at this time, but definitely treatable. And you know, for many afflicted with Ph positive CML, the treatments are very effective, enough to make one think you don't need the medication anymore, and that is a dangerous pitfall. Joining us this morning now is Greg Stevens. Greg was a caregiver and is now executive director of the National CML Society. He's here to tell us what it's like living with someone diagnosed with Ph positive CML. And Greg, good to have you here. Good morning to you.
Good morning, Daniel. Good to be here.
You know, isn't that such an interesting thing? You are director of the National CML Society, but you have also taken care of someone diagnosed with Ph positive CML. What was that like?
With caregivers, we can be a great team player and come in and help our loved one or whomever that is to understand all the things that are out there. Be an extra set of ears at the doctor's office, because you know you have all these acronyms flying at you and all sorts of things that we're beginning to talk about, tests and drugs and possibilities, and a lot of times that can be overwhelming, particularly once you've heard that word cancer. So just being a good listener.
And can it get a little bit overwhelming, and how do you cope?
It can, and you know, it's interesting. A lot of times as caregivers, we think we have to do it all. We have to fix this person, and there's really nothing we can do other than be of assistance to that person. And a lot of times we have to know our limits. We have to take time away. And one thing that's really important to understand about taking time away as a caregiver is that patient needs time away from you as well.
Now, your role as Executive Director of the National CML Society, tell us about that and why you feel the NCS is such an important organization.
Well, it's important because it brings community to this group of individuals that are living with this. And remember, when you're diagnosed with any type of cancer, it affects the entire family. So not only is there the person that's going to be living with the disease inside their body, but there's also the family members and the friends, and questions come, and you know, how do you answer those questions? What can we do to learn our local resources? And as the society grows, we are hoping and seeing a great amount of new resources becoming available, and we want to make this a one-stop shop for people that are diagnosed with this, where they can come and see information that is current, it's real, it's relevant for what they're facing on a day-to-day basis.
Well, I have to tell you, such an interesting perspective you have, being on both sides of this, and thank you so much for sharing it with us.
Well, thank you, Danielle.
And if you know anyone diagnosed with Ph positive CML or have a loved one with Ph positive CML, you should go online to support4cml.com. That's support4cml.com to learn about this form of leukemia, its treatments, and see how you can live with it.